Hello, I'm Dr. Jacob Deniakos. Today we are going to be talking about what is a root canal. We get asked that a lot, and so we just want to kind of give you some more clarification on that in case you might have some questions that might be, going through your mind. So what is a root canal? We do a lot of root canals in our practice, and sometimes, a patient might know that they need a root canal, sometimes not. A root canal, in its essence, is basically if you have some kind of insult or injury to the nerve of the tooth, which is called the pulp, right? Contains the nerve and blood vessels. At that point, you might have either inflammation or infection. Sometimes you know it, sometimes you don't. We need to make sure we clean that out and that the tooth is nice and healthy. So that's really what a root canal is designed to treat. Another question we often get asked is, what are some of the signs that I might need a root canal? Sometimes, again, you might have pain, right? That's one of the most common things that we see, and that can result of either a fracture or decay or infection, inflammation, those kinds of things. However, sometimes you don't even know that you need a root canal, which is why it's so important that you come see us on a regular basis. That's what our job is to do, is to help you out with figuring out what do you need, and then ultimately to help you get the treatment that you need to get your mouth healthy. Can a root canal save a cracked tooth? Especially whenever we get stressed in life, it's common that we either clench, grind, have wear. These are super common things that we see. A lot of times that'll lead to fractures or cracked teeth, right? In many of those instances, a root canal, if caught early enough, can save the tooth. And so we want to try to catch it on the early side so we can help you save your natural teeth. So when might it be too late for a root canal? Unfortunately, in some situations, when say a crack extends all the way through that tooth, it can render the tooth what we call non-restorable, meaning that we can't really put it back together. At which point we might have to talk about some other options. But the goal is always to try to catch it as early as possible and to help you save your natural teeth. What actually happens during a root canal? Basically, the first step is that we want to make sure we get out any kind of decay, any kind of fractures, and make sure the tooth is actually savable. 2 thumbs up, right? Once we get past that point, we're going to make sure that we clean out any inflammation or infection from the inside of that tooth, at which point we will disinfect it, seal it off with some cement and sealer, and then we get it ready for a nice crown afterwards, or a cap on top to protect it. That's a root canal. How long does a root canal procedure last? Most of the time, especially with our modern equipment, we're able to get in and out in anywhere between sometimes as little as 15 to 30 minutes for some teeth. Sometimes it can be as long as about 45 minutes to an hour, depending on the complexity of the tooth or what type of tooth it is. But we want to make sure we get everything cleaned out as we do so, of course. A lot of patients will ask me, will I need a dental crown after a root canal? And the short answer is yes. It is mandatory that you get a dental crown or a cap on top of the tooth, especially for back teeth, anytime that you have a root canal. Think about it. A root canal is designed to fix a tooth that has either severe inflammation, infection, a crack, something else. A lot of times they're having things like decay. Those teeth are weakened. And because of that, we want to make sure that ultimately that tooth lasts in your mouth, right? So what is a dental cap or a crown? Basically, a crown's like a helmet, covers the tooth, helps to protect and splint that tooth structure together to make sure that tooth is nice and strong and that it looks good, feels good, and lasts you a long time. So one question we get asked is, what type of anesthesia is going to be used during a root canal procedure? Of course, we're going to use what we call local anesthesia or numbing medication. So we do have to get you numb just like any dental procedure. We will make sure you're very comfortable during that whole process and that it's pretty minimal pain to get that done. Sometimes we'll even look at things like a sedation or something that helps out with that. But the main thing is that you're going to be nice and numb and very comfortable the whole time. How safe is a root canal? In general, root canals are very safe. Now, you might have heard, there's a lot of stuff online. Somebody had some bad incident or something negative happened when, say, somebody you knew had a root canal. In many instances, it used to be the case, right? Things were a lot more difficult. We couldn't get the tooth as clean. We couldn't get it disinfected properly, and it took a lot longer. Today, that's completely different. Today, we have modern equipment that allows us to be able to clean the tooth very effectively, very quickly, relatively speaking. We can typically get the whole process done in one appointment. At our practice, we do a ton of root canals, and most patients do extremely well following endodontic or root canal treatment. So another question we often get asked is, how do I, as a patient, prepare for a root canal? What you're going to want to do is just eat a normal diet, unless we're talking about a sedation or something like that, which we will definitely give you good instructions to follow. But eat a normal diet, make sure you're well hydrated, and then just show up. We'll take care of the rest. So how will I, as a patient, feel after a root canal? The studies show that about 60% of patients are going to know that ultimately something happened, but it might be a little sore. I was working on you, but it shouldn't be anything painful. And if you're able to take things like over-the-counter, what we call NSAIDs, like ibuprofen, naproxen, basic stuff like that, you're going to want to stick with that for the first day or two just to kind of help you get over that initial hump. In about 30% of cases, you're going to feel totally fine. Hopefully that's great, and you'll be like nothing ever happened at all. And in about 10% of the cases, it might get a little bit worse before it gets better, in which case just stay in communication with our office and we'll help you get through that too. So will my tooth be sensitive after a root canal? In a lot of instances, it'll feel totally fine afterwards. I mean, that's what we're always shooting for. However, it's not uncommon for it to be a little bit tender as things continue to heal, but in most cases, most patients do great. How long does it take to recover from a root canal? Everybody's different, of course. We are dealing with biology and we're dealing with the healing process. A root canal is done on a tooth that has some kind of insult or injury to the nerve. And so because of that, it can take anywhere from a few days to a week or two usually to get better in most cases. What is the best way to recover after a root canal? So you're gonna wanna try to be gentle with the area that just had the root canal. Try to avoid eating on that tooth for a few days just to kind of let things start the healing process. Of course, stick with any post-operative instructions that we give you. Make sure we get any kind of crown or cap completed as quickly as possible, and that'll allow you to get back to good chewing function as soon as possible. Do I need a root canal or should I just go ahead and get an implant? Those are two separate treatments and it kind of depends on what's needed at the end of the day. If we're able to save your natural tooth, we are always going to try to do that because ultimately you can't get better than God gave you, right? So a root canal treatment is designed to help you save your natural teeth. In some of those instances, however, if there's a fracture through the roots or some infection that's really way too big, at which point we might consider something like a dental implant. But that's kind of a treatment for when you're missing a tooth. A root canal treatment is designed to help you save your natural teeth, and we're always going to try to focus on that when and where we can. So why is a dental crown necessary after getting a root canal? Those two things typically go hand in hand. After we get a root canal, tooth is weakened. Typically it's already weakened before that, and then we have to ultimately do some more work on the tooth to get it nice and clean. So afterwards, we want to make sure that tooth is stable so it looks good, feels good, and lasts you a long time. Dental crown or a cap is what is needed for that. Any back tooth is going to be mandatory that you get a crown on the root canal treated tooth. Any tooth in the front, it's going to be the majority of the time that you're going to get that. So the way it works is we finish the root canal, we shape your tooth for the crown, shape it from the sides and the top to receive the crown like a helmet, and then we do a scan of that area or an impression or mold of that area. In our practice, we actually incorporate same-day dentistry. And by that, I mean that we're able to manufacture a lab quality crown in our office. So that way you're able to get the entire process done in one visit, the root canal is done, the crown's on, your tooth is healthy, and that way you can get back to normal chewing function as soon as possible. One common question is, how much does a root canal cost? Of course, there's a gazillion different variables that we have to consider, ranging from insurance, what kind of tooth it is, what type of endodontic therapy is needed, meaning root canal therapy. There's a lot of different variables that go into answering that question. The best way to answer that question is going to be to come see us and let us do a full comprehensive workup on you, see what's needed, after which we can definitely give you a more accurate quote and help you out with any kind of financial questions that you might have. So on that last point, a lot of times, we find ourselves needing to spend money on something that we don't necessarily want to do, right? I get it. If we could talk about going to Disney World versus getting a root canal, might choose to go to Disney World. However, we also need healthy mouths and healthy bodies to be able to function and to be able to live the best life possible. When it comes to financing, don't worry about that too much. We have a lot of plans, we have different options. Our job is to basically help you get the dental treatment that you need. Our team are experts at helping out with folks figure out things that fit into their budget to make sure it makes sense for you. I hope I've been able to answer some of your questions that maybe you had on root canals, but if you have additional questions or would just like to maybe let us have a look at your tooth or teeth, just give us a call. Our number here is 337-993-3223. We are always happy to help.